knowledge on a central nervous system disorder called epilepsy. Epilepsy is a neurological disorder of central nervous system in which brain activity becomes abnormal, causing seizures and period of unusual behavior, sensation, and sometimes loss of awareness. Seizure symptom can vary widely. Some people with epilepsy simply stare blankly for a few seconds, while others repeatedly twist their arms or legs. Having a single seizure doesn't mean that you have epilepsy. At least 2 seizures with known trigger that happen at least 24 hours apart are generally required for an epileptic diagnosis. Treatment with medication or sometimes surgery can control seizures for majority of people, while epilepsy with some people require lifelong treatment to control seizures, but for others the seizures eventually go away, and in some children with epilepsy the condition outgrows with age. Symptoms of epilepsy. As epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates, and symptoms may include number 1, temporary confusion, number 2, a stammering spell, number 3, stiff muscles, number 4, uncontrollable jerky movements of arms and legs, number 5, loss of consciousness or awareness, and number 6, psychological symptoms such as fear, anxiety, or deja vu. Symptoms may vary depending on type of seizures. In most cases, a person with epilepsy will tend to have the same type of seizures each time, so the symptoms will be similar from episode to episode. Some of the rare epilepsies are caused due to genetic metabolic disorders such as neuronal ceroid lipofuscinosis and mitochondrial encephalopathy. Classification of epilepsy. Doctors generally classify seizures as either focal or generalized based on where the abnormal brain activity begins. Number 1, focal seizures. When seizures appear as a result from abnormal activity in just one area of your brain, they are called as focal seizures. These seizures fall into 2 categories. Number 1, focal seizures without loss of consciousness. Once called as simple partial seizures with elementary symptomatology, these seizures don't cause any loss of consciousness. They may alter emotion or changes the way they look, smell, feel, taste, or sound. Some people experience deja vu. This type of seizures may also result in involuntary jerking of one body part such as an arm or leg. Number 2, focal seizures with impaired awareness. Once called as complex partial seizures with complex symptomatology, these seizures involve a change or loss of consciousness or awareness. This type of seizures may seem like being in a dream. During a focal seizure with impaired awareness, person normally respond to your environment or perform repetitive movements such as hand rubbing, chewing, swallowing, or walking in circle. Symptoms of focal seizures may be confused with other neurological disorders such as migraine, narcolepsy, or any kind of mental illness. A thorough examination and testing are needed to distinguish epilepsy from other disorders. Generalized seizures. Seizures that appear to involve all areas of brain are called as generalized seizures, and they include number 1, absent seizures. Previously known as petit mal seizures, this type of seizures typically occur in children, and they are characterized by staring into spaces with or without subtle body movements such as eye blinking or lip smacking, and only last for 5 to 10 seconds. These seizures may occur in cluster, happening as often as 100 times per day and cause a brief loss of awareness. Number 2, tonic seizures. Tonic seizures causes stiff muscle and may affect consciousness. These seizures usually affect your muscle at back, arms, and legs and may cause you to fall. Number 3, atonic seizures. Atonic seizures are also known as drop seizures. Causes loss of muscle control since the most often area is legs that gets affected. It often causes you to suddenly collapse and fall down. Myoclonic seizures. Myoclonic seizures usually appear as sudden brief jerk or twitches and usually affect the upper body, arms, and legs. And the last is tonic-clonic seizures. Known as grand mal seizures, these are the most dramatic type of epileptic seizures. They can cause an abrupt loss of consciousness and body stiffening, twitching, and shaking. They sometimes cause loss of bladder control and biting your tongue. Causes of epilepsy. Epilepsy basically has no identifiable cause in about half the people with the condition. In the other half, the condition may be traced due to various factors including number 1, genetic influence. Some type of epilepsy which are categorized by type of seizures you experience or the part of brain that is affected runs in families. In these cases, it is likely that there is a genetic influence. Number 2, head trauma. Head trauma as a result of car accident or other traumatic injury can cause epilepsy. Number 3. Brain abnormalities. Abnormalities in brain including brain tumor or vascular malformation such as atriovenous malformation can cause epilepsy. Number 4. Infection. Meningitis, HIV, viral encephalitis and some parasitic infection can cause epilepsy. Number 5. Prenatal injury. Before birth, babies are sensitive to brain damage that could be caused by several factors such as infection in mother, poor nutrition and oxygen deficiencies. The brain damages can result in epilepsy or cerebral palsy. The last is developmental disorder. Epilepsy can sometimes be associated with developmental disorders such as autism. Treatment of epilepsy. There are enormous drugs used for treatment of epilepsy and the most common drug we will discuss here is phenytoin. Phenytoin is classified as a hydantoin derivative and despite its narrow therapeutic index, it is one of the most commonly used anticonvulsant drugs. Since its introduction about 80 years ago, phenytoin has not only been established as an effective anti-epileptic drug but has also been investigated for several other indications such as bipolar disorder, retina protection and wound healing. Phenytoin is also used to treat grand mal seizures, complex partial seizures and to prevent and treat seizures during neurosurgery. Injectable phenytoin and phosphenytoin, which is phosphate ester prodrug formulation of phenytoin, are indicated to treat tonic-clonic status epilepticus and for the prevention and treatment of seizures occurring during neurosurgery. Pharmacodynamics. Phenytoin is an anticonvulsant drug with narrow therapeutic index, although the recommended therapeutic range is stated to be between 10 to 20 mg. Differences in albumin level, genetics, comorbidities, and body composition can make achieving an ideal phenytoin dose challenging. For example, studies have confirmed that phenytoin metabolism is impacted by CYP2C9 genotype polymorphism and possibly by CYP2C19 genotype polymorphism. It is worth noting that although phenytoin is highly protein bound, only the fraction amount is able to exert a pharmacological effect. For example, concomitant administration of drug that can cause displacement from protein binding site can have a marked impact on phenytoin therapy. Mechanism of action. Although phenytoin first appeared in the literature in 1946, it has taken decades for the mechanism of action to be more specifically elucidated. Although several scientists were convinced that phenytoin altered sodium permeability, it wasn't until the 1980s that the phenomenon was linked to voltage-gated sodium channel. Phenytoin is often described as a non-specific sodium channel blocker and target almost all voltage-gated sodium cells. More specifically, phenytoin prevents seizures by inhibiting the positive feedback loop that results in neuronal propagation of high-frequency action potentials. Metabolism. Phenytoin is extensively metabolized and is first transformed into a reactive arene oxide intermediate. It is thought that this reactive intermediate is responsible for many undesirable phenytoin adverse effects such as hepatotoxicity, SJS, TEN and other iodosyncratic reactions. The arene oxide is metabolized to either a hydroxyphenytoin or phenytoin dihydrodiol metabolite, although the former accounts for about 90% of phenytoin metabolism. There are also some adverse drug reactions of phenytoin, and they are lupus erythematosus, megaloblastic anemia, pulmonary fibrosis, hypocalcemia, hypertrophy of gums and blood dyscrasis. At last, I would like to express my deep gratitude towards my college principal Dr. Nilesh Malviya who gave me this wonderful opportunity to present an informative video on the topic that helped me in doing a lot of research and enhance my knowledge about the subject. Thank you.